Plunging a toilet works best when you control the seal, the pressure, and the rhythm rather than relying on brute force. Start by seating a flange-plunger so the rubber insert fully fills the drain opening, and use warm water to ensure a tight seal. Pump slowly at first to compress air and create a vacuum, then increase to steady, firm strokes that maintain the seal. Avoid rapid jerking motions that break suction. If the bowl is nearly full, remove excess water with a small container to prevent splashes, but keep enough water to cover the plunger head for effective suction. Before plunging, push down gently to expel trapped air away from the hole so you force water, not air, into the trap. If you meet resistance after several strokes, pull up slowly on the plunger to release pressure and check for visible obstructions with gloves or a plumbing snake if comfortable. After clearing, flush once to verify flow, and then clean the plunger and surrounding area with a disinfectant solution to prevent bacterial transfer. Common mistakes include not making a proper seal, which lets air escape and stops pressure transfer, so press the plunger in and adjust the rubber flange until you feel continuous suction. Another is plunging too aggressively at the start, which can splash contaminated water and may push the clog deeper, so begin with modest, controlled pumps and only increase force if the seal holds. A third is failing to release trapped air first, leading to ineffective plunging, so always press down gently to expel air before working the handle and periodically lift slightly to rebalance pressure rather than moving the plunger side to side, which breaks the seal. BigHomeProjects.com helps homeowners find local contractors and contractors find work by connecting people based on project needs and service area. We also host a discussion community where we share practical tips, ask questions, and learn from other homeowners and tradespeople.